Ready for another installment of Myth-Busting AMAs? Let's talk obesity. You know, this is a super popular topic. Not going to tell you everything about obesity that I know or that I could talk about because it's going to take me a few hours, maybe even a few days if I talk continuously. It's a pretty big topic. So what is it that I want to myth bust? Well, this concept of once you have obesity, you will always have obesity, and once you start obesity meds, you will always have to take medications to treat your obesity. It's kind of a true story. It's kind of a true point. So why is that? Let's just kind of dive into that for a minute. So when you have obesity, your body is not able to manage and maintain its energy needs. It doesn't understand how much energy you're using, doesn't understand how much energy you need to maintain that. And this is dysfunctional for a variety of reasons. It could be genetic, it could be environmental, there could be medications, and 1,000 reasons we're not going to dive into today. But if you have been successful in using lifestyle to manage your obesity, congratulations. That's super hard work, and you deserve all the kudos for that. Absolutely true. And if that's the case, then I'm super happy for you and I'm super proud of you because that is a lot of effort. But that's not always the case for a lot of people. And if you fall into that category where lifestyle maybe works a little bit, maybe sometimes it works, but then it stops working, then you probably have chronic obesity. And your lifestyle only manages to maintain stability for a period of time. Because as you age, your body decays. It's kind of the natural process of aging if we're all fortunate enough to do that. And in that decay, it becomes harder and harder for you to maintain health. And a healthy weight is part of that. So if it becomes harder for you to maintain your health, it should be obvious then, and it's harder to maintain your weight. So the things you have to do to maintain your weight as you age become extraordinary. So lifestyle works. Changing your lifestyle works periodically. Sometimes you change your lifestyle a lot. It works a lot better. But again, this shifts as you age. It becomes harder and harder to maintain. And so if you require additional therapy to manage your excess weight, like medications, then you will likely always need medication for life to manage that excess weight because it only worsens as you age. So that can be a daunting statement for a lot of people. Some people are very upset by that concept. They think that they should be able to get their weight down to where it needs to be and then come off the medications and then magically they're going to maintain that weight. But the reality is your brain has a set point. Your body has a set point. You have genetics that are propelling you down that path. And if you are able to maintain it with lifestyle, again, kudos to you. That's super awesome. I'm happy for you. But if that's not you, that means that you have that genetic propensity, you have the disease of obesity, and you have a process that has to be addressed as you age, often with chronic medications. Now, the medicines you use to get your weight down may not be the medicines you stay on to keep your weight down, and they may not be the medicines that you take forever. Whatever medicine you use today, tomorrow, for this year, it's great. It may work for you wonderfully, but then in a few years from now, that may not be enough, or there may be a better medicine out. And so if you have the disease of obesity, and if you struggle with maintaining your weight, lifestyle is critical. It's never the wrong answer. It will always be a part of what we have to do to maintain a healthy weight. But if you also require the assistance of medical management, you will likely always require the assistance of medical management. It's a matter of finding the right drugs, the right way, and the right time, and the right order for you to be as optimal as possible so that you feel in control as much as possible. And not that your weight controls you, but that you control your weight.